Texas lawmakers push back against the governor's response to COVID-19.
He needs to allow the local governments to do what they need to do to keep their communities safe.
Why the governor is facing pressure from all sides as cases rise across Texas.
Greg Abbott, you've got a few business owners who'd like to have a word with you.
They closed down for more than 2 months, opened for one, then the governor shut them down again. How Texas bar owners and workers are fighting back to save their jobs. Plus, COVID-19 and the 2020 election. As voters head to the polls, we look at how the virus is affecting races on the ballot and changing the way some Texans vote. Hello, and thank you for joining us for State of Texas. I'm Josh Hinkle. You may notice that things are a little different this week as we've taken the program out of the studio. It's a little adjustment for social distancing amid the latest surge of COVID-19 in Texas. The surge in COVID-19 cases also has Texans looking to get tested for the virus. The demand is causing long waits in many parts of the state. You're looking at video of dozens of cars lined up outside a testing site in Dallas. Some people reported waiting for several hours to get a test, and when people do get tested, some people report having to wait several days to get the results. The increased need for testing is just one part of the crisis that's putting a strain on state resources. Our Wes Rappaport checked in with Emergency Management Chief Nim Kidd to find out how the state is responding to growing needs across Texas.
We've hit some speed bumps in terms of people being hospitalized, and we're seeing more cases right now. Is that a reflection on the state response, or is that a reflection on just the way that this virus is spreading?
So I will say we have had a very dynamic response to this. I mean, we've been using the analogy of trying to build the airplane as we're flying it. We think back not that long ago, there was one lab in the nation that was capable of returning a COVID-19 test. Now we're at over 960 sites that you can give a specimen and hundreds of labs that are doing COVID-19 tests. So building that during the response for something that didn't exist before is a very dynamic response in my mind. Now to the point about why are we seeing an increase right now? I think there have been many milestone events. I don't think any one of them in singularity has the sole responsibility, but we had graduations, we had Memorial Day, we had Mother's Day, we had protests out there. We had a lot of different things where people came together and didn't follow the instructions of the doctors. People were not wearing masks in public. They were not staying 6 feet apart.
You mentioned that there's between 900 and 1,000 testing sites across the state, but only a small portion of those are state-run sites. What does that say about the role of the private sector?
We know all disasters are local, and healthcare, again, primarily in the private sector. As soon as those private sector facilities and teams and personnel can come up, we are in a much more stable and sustainable posture in place. And it's our local government at the local level working hand in hand with the private partners, whether it's the pharmacies like Walgreens and CVS and Walmart and H-E-B's coming on and Rite Aid, all these other pharmacies that are starting to do their own testing in the private sector. Your family practice physician, private sector. Your hospital that you probably go to, private sector. So letting them build the healthcare system that they run and manage is the right thing to do. Our job to be to augment that support, offer support, and be sure that we have met the need in places that may not have it organically.
What is it going to take in the state of Texas to keep people safe until we get a vaccine, or even after we get a vaccine?
Wearing a mask over your nose and your mouth. It's making sure that you wash your hands. It's making sure that the high-touch things that you touch are clean and that we keep doing that. And don't be around people if you don't have to. I mean, don't be going to parties. Don't have everybody over for family barbecue without knowing where everybody else has been. I mean, this disease spreads very easily. Remember when we had to put on the click it or ticket in order to get people to wear seatbelts? So now should we look at mask it or casket?
The Department of Emergency Management has an online tool to help you find places to get a COVID-19 test. The department's website features an interactive map to help you find the closest locations to offer the tests. Governor Greg Abbott has controlled much of the state's response to the COVID-19 pandemic, rarely ceding control to local leaders. Politics reporter John Engel shows us how the governor faces increasing pressure from state lawmakers who want a seat at the table and from members of his own party who say he hasn't gone far enough in reopening the economy.
Many are struggling to pay their bills.
On April 27th, Governor Greg Abbott announced phase 1 of his plan to reopen the economy, facing pressure from Republicans to get Texans back to work. That day, the 7-day average of new COVID-19 cases was 834. Today, it's 6,020. Dr. Anthony Fauci from the White House Coronavirus Task Force warned about the direction Texas is heading in. Lieutenant Governor Dan Patrick rejected that warning, telling Fox News' Laura Ingraham that he and Governor Greg Abbott listened to other doctors to make their decisions. That power at the top has state lawmakers pleading to be involved.
These emergency powers that you are using, we granted them to you, but we never gave up our own power.
Abbott changed his own order under pressure from conservatives when a Dallas salon owner was jailed for unlawfully opening her doors. He's grappled with local leaders over public health orders.
He needs to allow the local governments to do what they need to do to keep their communities safe.
Abbott paused Texas's reopening, acknowledging the bars may have been reopened too soon. But he said shutting down the state again would be a last resort. For State of Texas, I'm John Engel.
Governor Abbott also faces a legal fight over his order to shut down bars. 2 lawsuits were filed this week by different groups of bar owners claiming the order violates their constitutional rights.
We come in peace. We want answers. We need to know why.
On Tuesday, several dozen bar owners and workers rallied outside the state capitol and then marched to the governor's mansion. Some carried signs saying "Bar Lives Matter." Protesters say they feel singled out since they were the only indoor business required to keep patrons out entirely. They say it's unfair to penalize bars that follow the recommended safety guidelines.
We measured out every single table, every chair, we basically overhauled our whole bar.
We had hand sanitizer all over the place. We got the plastic over the register where they walk in.
The governor said he based his decision on data. He says the numbers showed that many people who tested positive in recent weeks contracted COVID-19 in bar-type settings. The governor's rollback on reopening means a lot of Texans just lost their jobs again. Last time around, people who filed for unemployment faced a lot of problems and long waits for benefits. Why the head of the Texas Workforce Commission says things could be different this time. COVID-19 is reshaping the 2020 elections. How the pandemic is affecting candidates, campaigns, and counties struggling to find election workers. The story coming up on State of Texas. As COVID-19 restrictions force more businesses to cut back, the Texas Workforce Commission is bracing for a new surge of claims for unemployment. Texans who just lost their jobs face the prospect of long waits for unemployment benefits again. Our Wes Rappaport pressed the head of the Workforce Commission to see what the agency is doing to help a new batch of callers who need help and money.
All they had to do was just go in and fill out their claim and start collecting their money. And out of 9 employees, I had 1 that was able to do that.
Sonia Wilson thought she was setting her employees at Southpaw's Play School up for success when she furloughed them in March. But she then found herself spending hours trying to get a hold of a person at the Texas Workforce Commission to help.
30 hours a week we were spending calling the number, trying to get all of our employees set up for unemployment.
For some, first of the month rent is due and they need to get a hold of a person to help process their claim, whether they're filing for the first time or filing again.
We know that you are desperately needing to speak to somebody.
The Texas Workforce Commission says if you had already been receiving unemployment benefits, then went back to work and lost your job again during the state's reopening rollback, the process for new benefits to kick in is shorter.
From the last time you requested a payment from us, if you went more than 3 weeks, then you have to file an additional claim. Just check off, it's a little drop-down menu. Check off laid off.
Wilson says TWC finally wrapped up the process for all of her employees this weekend, and it stressed her team out in more ways than one.
It's not helpful to our mental health, the health of my employees, to wonder whether they're going to be able to pay rent or whether they're going to get evicted, whether they're going to get, where their meals are going to come from.
I'm Wes Rappaport for State of Texas.
The Texas Workforce Commission tells us it has boosted its digital operations in response to the high call volume of Texans needing guidance through the claims process. The TWC chatbot can now answer 100 different questions. Protests in the streets could lead to action in the voting booth. Why the calls for justice reform could affect some races on the ballot. COVID-19 and the candidates, how the virus is shaping the debate in some runoffs and directly affecting one candidate for Congress. Curbside service has become a way to go to get many of the things you need. Now you can add voting to that list. The effort to make it easy and safe for Texans to cast their ballot. Black Lives Matter protests sparked by the in-custody death of George Floyd brought thousands of Texans to the streets. Now, some are also taking the call to action to the voting booth. Issues of policing and justice will affect several runoff elections, among them the race for district attorney in Travis County. Our Avery Travis looks at how the candidates pointed out some of their key differences.
Justice in policing.
Members of our community, especially people of color, are hurt or killed every single year at the hands of law enforcement officers.
And in the courtroom.
I created a civil rights division to bring new and important reforms to the way we treat our investigations of officer-involved use of force cases.
Margaret Moore is running on her experience as Travis County DA for the last 4 years and elected office for decades before that. Meanwhile, her opposition, Jose Garza, executive director of the Workers' Defense Project, says it's time to completely reimagine the job by ending cash bail and the prosecution of low-level drug crimes.
I think every person who is sitting in our jail simply because they can't afford to pay bail should be released.
But Moore argues they have to balance reform with public safety.
The overwhelming majority of people in the jail are charged with very serious offenses. I just read them off: murder, robbery, sexual offenses.
Moore noted her hand in starting the office's first adult sex crimes unit, but has been widely critiqued over her handling of sexual assault cases.
Our district attorney has lost the trust of survivors of sexual assault. And survivors in our community feel like they can't get justice.
He can make a whole lot of promises, but one thing he has not done, he has not sat in a courtroom like this DA has, like I have, with the parents of that victim, with the victim herself, holding her hand, walking out with her while she throws up because the jury found her assailant not guilty.
Avery Travis for State of Texas.
Thanks, Avery. The winner of the Democratic runoff will face Republican Martin Harry on the ballot in November. When longtime Democratic State Senator Kirk Watson retired, several candidates jumped into the special election to fill his seat. He represented the 14th District, which covers parts of Travis and Bastrop County. Voters will choose between 6 candidates in this special election. Politics reporter John Engel breaks down each candidate's experience and the approach they would have taken to the coronavirus pandemic.
Sarah Eckhart stepped down from her role as Travis County judge in May, but remains an advisor to the county as it navigates the COVID-19 pandemic.
I think it's really important to have people like myself whose experience is actually in implementing policy to go up and write the policy and get it passed.
State Representative Eddie Rodriguez has served part of Travis County in the Texas House since 2003.
Let's look at how we can modernize the Workforce Commission, for example, where you had people that were really struggling to get their unemployment benefits. Let's create a 21st Century Workforce Commission.
Don Zimmerman served the Austin City Council for 2 years. He believes the response to the pandemic has been too strong.
We disagree about shutting down the economy over misguided models and over promises by government that they can solve the pandemic problem, which they cannot solve.
Former prosecutor Waller Thomas Burns II said he'll decide his agenda once he arrives in the Senate.
I don't know what might cross my desk or what I might sponsor as a bill.
Dr. Jeff Ridgway says the special election is a unique opportunity for an independent candidate and believes state leaders have handled the pandemic well.
I don't know that closing down our economy again is going to do much good at this point. Not only because I feel like there's already so many people infected out there, but I also feel that people are kind of at the end of their rope in terms of what they can handle economically.
Pat Dixon is a libertarian who believes the pandemic needs to be a learning experience.
What I'm doing is interviewing for a job saying, I don't know all the answers, but what I'm going to do is listen, deliberate, and use common sense.
For State of Texas, I'm John Engel.
How to respond to the coronavirus is also a key issue in a race for Congress in Central Texas. We're talking about District 31, which covers Williamson and Bell counties. Two Democrats are in the runoff to see who will face incumbent Republican John Carter in November. Back in March, Dr. Christine Mann led the way with 36% of the vote in the Democratic primary. Computer engineer Donna Imam took 30% to make the runoff. Both candidates say healthcare reform is their #1 policy.
The COVID-19 crisis has made that even worse. So many people have lost their jobs and their health insurance is tied to their jobs. We need to decouple insurance and employment so that you never have to worry that you're going to lose your health insurance when you lose your job, or if you lose your job, or if you get a pre-existing condition. And we need people in office who understand intimately the healthcare system.
Health insurance is not healthcare. They have no incentive to give you high quality care. They have no incentive to lower your health care, and they have no incentive to make it easier for physicians to take care of you and do preventative care. The more you spend in healthcare, the better it is for their bottom line. So #1, single payer healthcare. Who does contact tracing? Tech companies do contact tracing. We need people in Congress that understand technology.
A candidate in a different congressional race says she's tested positive for COVID-19. Renee Swan faces former Congressman Pete Sessions in the Republican runoff for U.S. House District 17. Swan posted on Facebook that she tested positive but said she does not have symptoms. Previous posts show Swan had been holding in-person campaign events before the diagnosis. One post from Monday showed her posing with voters outside a polling place in Waco. Swan said she would be in quarantine for the rest of the early voting period. She posted her cell phone number on Facebook as a way to reach out to voters. District 17 includes Waco, College Station, and part of Austin. Incumbent Republican Bill Flores is retiring.
It's been the weirdest year I've ever lived, especially in the elections career.
Early voting begins with precautions to protect voters from COVID-19, but they're not the only ones worried. How the pandemic is causing problems for counties struggling to find election workers. As much of the state closes down once again because of COVID-19, polling locations opened up for local elections. The virus is bringing some changes for voters and election workers. And it's bringing new attention to the option of curbside voting. Our Wes Rappaport takes a closer look.
It's an option for voters that may take longer, but give you peace of mind as you cast your ballot.
And if a voter feels like they are symptomatic or may have been exposed to a person with COVID-19, we encourage them to utilize curbside voting.
Curbside voting allows Texans to vote from their car. Texas election code says voters who are physically unable to enter the polling place without personal assistance or likelihood of injuring the voter's health qualify.
It's required by state law for every polling place to have available curbside voting for those persons who feel like they may injure their health if they enter the polling place.
But it sets up the potential for some voters having to wait longer in the car.
Curbside voting has been used for a while, but it's not used in mass. And in truth, elections are not set up to be drive-through. And that's sort of what this is. So it's a little bit slower process.
If you plan to use this option, the state suggests you call your county elections office ahead of time so election workers can prepare the proper voting materials for you. I'm Wes Rappaport for State of Texas.
The Secretary of State's office encourages voters to bring their own hand sanitizer and wear a mask to the polling place. But voters are not the only ones worried. It is becoming increasingly difficult for counties to find election workers during this pandemic. Nabil Ramadna explains the challenges one county is facing now as they look ahead to November.
How do you vote if there's no one staffing the polling location?
Days after the March primary, we were getting phone calls from people that were scheduled already to work in May, and they were dropping off. You know, they were just saying, no, we're not going to do that. We're not going to do it.
COVID-19 can have that effect. Burnett County Elections Administrator Doug Ferguson says the current election was difficult to staff, but they got it done.
It's been the weirdest year I've ever lived, especially in the elections career.
As COVID-19 cases continue to rise across the state, Ferguson is now eyeing November's election and the possible issues they could face with staffing.
Every time we get to talk to one, we're making notes. We're asking them, are you still interested in working in November? And so we're kind of starting to make notes on our list of poll workers.
Safety, the biggest concern. Burnett Mayor Krista Bromley hoping her citizens follow the CDC guidelines for the sake of those working and those voting.
Of course, it's so important to get out and vote, but to take care of yourselves and to take care of others around you, and you do that by adhering to the social distancing and the wearing of the mask.
Trying everything you can to make sure that everybody's protected. At this point, who knows what November is going to be like.
Nabil Ramadna for State of Texas.
Thanks, Nabil. And it looks like election officials across Texas will get some help from Congress. Lawmakers approved more than $26 million in emergency funding for elections as part of the CARES Act. The money can help cover costs related to COVID-19, things like hand sanitizer and PPE. The funding can also pay for temporary staff and equipment to allow people to work remotely. Thank you for watching State of Texas. I'm Josh Hinkle, again joining you from my house. Remember to do your part to help stop the spread of this virus. Stay safe, stay informed. We'll be back next week to bring you an in-depth look at Texas politics. Have a great day.